And what the third sector done, and this was about 14, 15 years ago now, when they started to make the transfer from the public sector into the third sector, because it was gradual, the third sector charities started to employ people in recovery, and they were much cheaper than nurses and social workers. So there was one sort of criticism of that was it was deprofessionalising the industry. But also what they did, the big charities, because they saw the austerity policies, they saw the Tory government come in,
Aye.
you know, these guys who run these big charities are not daft, right? So they saw the austerity policies come in and think, right, we've got to do more with less, how are we going to do this? They also had one of the biggest charities, well, the biggest charity now, also had a policy of bringing in 50% of their workforce to be volunteers. So what that created was a completely different culture in England and Scotland. So in England, you can walk into a service that day because it's in the third sector and not in the public sector where you have to get an appointment 2 weeks, 3 weeks for now. Third sector are more fleet of foot. You can walk in, you can get seen by somebody that day, you probably got on a script that day.
Wow. So that day you can get put in a script? Aye.
Probably within a matter of hours in England, right? So that's the first thing that's different because it's third sector.